In this episode, we are now going to discuss all about diabetic involvements of the kidney. One of the most important complications of diabetes that we are worried about is involvement of the kidneys. When you've had diabetes for a very long period of time, generally by the 5th or 6th year, you are worried about is the diabetes involving the kidneys. And at that point of time, you should start screening for diabetic involvement. The most important test that we carry out is to look for the protein excretion in the urine. It's a very simple test, and what you look for is presence of microalbumin in the urine. Another test that you can do is the urinary albumin creatinine ratio, and this usually is performed on just a spot sample of the urine. If you find that the microalbumin level is between 30 to 300, then we know that there is a significant microalbuminuria that is present. And this is one of the earliest indicators of kidney involvement of diabetes. Now, at this point of time, if we treat aggressively, we can reverse the involvement and you can bring the protein excretion down. This is usually effected by a good control of diabetes, a good control of blood pressure, and use of certain medications, what we call as ACE or ARB inhibitors. If we ignore this microalbuminuria, then gradually the protein excretion tends to go up and you may go into the macroproteinemic range. Gradually, the renal function tends to get lesser and lesser and the patient tends to develop overt kidney disease. This progresses ahead and you find that the markers of kidney involvement, what we call as blood urea and serum creatinine, tends to go up, and we monitor this periodically. A point of time comes when the kidneys are not functioning and the patient develops a full-blown kidney disease, and this patient heads for dialysis and ultimately kidney transplant. So just a simple test, what we call as microalbumin estimation of in the urine, may prevent all these complications from happening, along with a good blood sugar control. I hope you found this video informative. Stay tuned to our channel, do like our videos, and please offer comments and suggestions.